about a local nurse who's dealing with the after effects of COVID-19 11 months later.
Now we want to share with you what Portland metro area hospitals are doing for treatment. Fox 12's Brenna Kelly learned about how they're each supporting COVID long haulers.
According to research, about 10% of people with COVID experience symptoms lasting 3 months or longer. Now, while experts are still learning all about this, hospitals are beginning to put specialized treatments in place.
COVID can be really nasty, if not deadly, horrible effects on multiple systems in your body.
At this point, a lot of us have become numb to the tough news of the pandemic. But the reality is, COVID is still consuming our communities.
One of their worst issues is respiratory or pulmonary. So that is a focus of the treatment.
At Legacy's Good Samaritan Hospital, there is RIO, short for the Rehabilitation Institute of Oregon. I'm talking to Dr. Jean Button, RIO's medical director, and Tracy Hutchins, the therapy manager, about the COVID care they've blended into their normal rehab operations.
So this is the bridge between I was horribly ill in the hospital, I'm not well enough to go home yet, and this is going to get me better to go home.
It's been a year of adapting, and for Button and Hutchins, it's been rewarding too.
In this year of tumult and chaos and pandemic, we had to rehab and get them better, and get them home.
At Kaiser Permanente, they're forming a multidisciplinary team to care for the COVID long haulers, the small percentage of patients, about 1 in 10, who've been suffering symptoms for months.
What the pandemic has, afforded all of us is we don't need walls to be a clinic. I think we can have people who are specialists, who are, dedicated. They have the expertise, and they're just a video conference away.
Dr. Stella Dantis, Northwest Permanente's Associate Medical Director of Ambulatory and Convenient Care, says they're working on removing barriers for patients, contacting them as soon as they test positive, then also caring for those with symptoms past 28 days, which includes checking on a person's entire well-being.
There's a lot of support, I think, that can be had by just the outreach calls, just knowing, somebody's touching base, making sure that you're going in the right direction, or if your trajectory is different, what support needs to come.
By the way, at OHSU, they're working on developing a patient-centered program, hoping to have their program up and operational in the next month or so. And at Providence, there are teams working to come up with a comprehensive approach specific to each patient. Reporting in Portland, Brenna Kelly, Fox 12 Oregon.